it's always a pleasure being here. I was just wondering, this is the 8th event, and in such short time, I think we've reached so far. So let's begin. I think healthcare is getting disrupted. So let me show you a small video on this. So clearly a very different world. But let's start separately. So about 400 years ago, this is a French playwright. He wrote, "I find medicine is the best of all trades, because whether you do any good or not, you still get your money." And that's how it's continued for about 400 years. That's why it's a perfect business model. No wonder, every parent wants his child to become a doctor. No accountability, because no one knows what's happened to the patient. But I think that's changing a lot. I think suddenly people are asking the questions, and they're saying that we're paying for healthcare, so we are not a patient, we are a consumer. And I think that whole paradigm's changing. And are the doctors like politicians who are actually perpetuating a crisis for their own change? I don't want to say that, I being myself a doctor, but that's the thought now. Because people are wanting outcomes. And I think the greatest thing which technology can give you is that transparency and say, if you're spending money on medicine, is it really worth the change? So what do the doctors believe? The doctors believe that technology can never actually disrupt healthcare, because they think, human experts will always be needed for that tricky stuff. And what's the tricky stuff? Judgment, creativity, empathy. Technology can't. How can a computer do that? But here's the bad news. 85% of what a doctor does has nothing to do with judgment, empathy. It's just routine clerical work. It's all process-based. The second part is what's called the AI fallacy, the artificial intelligence fallacy. You know what the fallacy is? The fallacy says if a computer has to do well, he's to learn how a human does it. And that's wrong. Because computers with the access can do it much better, and they don't have to replicate what a human does. And I'll give you a very, very strong example as we go ahead. So you may all have heard that way back in 1997, human lost to a computer. But now, and that was DeepMind, but now they meet what's called Alphago. Alphago actually plays a game called Go, which is very complicated. It's, it makes chess look like, the alphabets, and this look like Shakespeare. It also builds it to, the level it builds is 10 to the power of 170. So that actually defies anything physically, because there are only 10 to the power of 80 atoms in the universe. So we can't even imagine how big it is. The second part is, when I as a doctor get into an ICU, what is my knowledge base? My knowledge base is what I learned in medical school, what my peers taught me, what my teacher taught me, what I've gathered from the internet, or what I've gathered from, but that's limited. What if I was empowered and I knew that in this case I'm looking at, maybe if I gave 0.5 ml of dopamine, this would happen. And that's for 2,000 cases. What happens if it's for 2 million cases? So like Sangeeta said in the morning, how do we empower the doctor more? So the second part is also Alphago. The whole thing, it learns on its own. And when they started this, and within the first day, it was better than the best professional player in the world. Today, what's the chance of a professional player beating Alphago in 100? Precisely 0. But the professional who actually played with Alphago, what he did, he won 22 consecutive wins because Alphago taught him something he didn't know. So clearly, the computers are smarter now. So who's this? Is this the highest paid clerical worker going ahead? But clearly, I think there's a huge disruption. At least at the first level, I think doctors will need to reinvent themselves. And this is a problem of being human. So I went to a conference in the US and they say, besides being human, the computers have a great advantage. They don't get drunk or fight with their spouse. So, you can rely on them more than humans themselves. The other part, I think, is we've really made healthcare very, very complex. So you look at the ICD coding, there are about 70,000 ways of getting sick, hurt, or mortally injured. So today, to an extent, no human being is able to even code diseases properly, because it's just beyond your comprehension to look at 70,000 and find out, to a third place of decimal, if you do an ICD coding, what should be right. So I think that's one of the biggest problems which has come in. Because it's become so complex, we are not able to fathom it. The second is, Deming said, in God we trust, all others bring data. And it's very true. A lot of decision doctors make is on a hunch and not on data. And our ability to actually integrate data and so a lot of people have data, but can you really make insights out of data? So I'll give you an example of correlations which only computers can do and which no human beings. So they found that the incidence of melanoma, which is a skin cancer, was rising in Sweden. And what did they actually attribute it? To the growth of low-cost airlines in Asia. Because the low-cost airlines in Asia were coming, so people from Sweden who typically don't go out in the sun, this young crowd was coming, roaming around in Asia. When they bent back, the incidence of melanoma was high. So now there's an advisory. If you're going to Asia, take a sunscreen. And nobody's even heard of a sunscreen because the sun is never warm enough in Sweden to, cause any harm. So that sort of correlation is beyond a human capability. How does this happen, actually? The other thing is, you don't need to go to a doctor to find out what's happened. If you just look at your credit card, it can tell you where your healthcare is. So these are some examples. So, if you're buying a lot of alcohol, there could be frequent, potential symptoms of depression. Your gym membership's lapsed, your potential risk of diabetes goes up. An asthma patient's buying cigarettes, you can make sure that he'll be in a hospital in a couple of days, and so on. So today, a lot of retail data can actually tell you about a patient even before he goes to the hospital. This is a very simple example of how technology can really help. This is an example from Kaiser Permanente, which you may have heard, which is one of the most famous HMOs. So in Kaiser Permanente, what they noticed is they had patients of congestive heart failure. The ones who got discharged and went to Richmond, both Richmond and Oakland are suburbs, had very low admission rates. The ones who went to Oakland had very high admission rates. So they did a deep dive on the data. So what came out that people who went with Richmond went actually with their families. When you go with your family, somebody cooks you a diet, a meal. The ones who but Oakland had a lot of old age homes. So these were single people. They went there, they put something out from the refrigerator, high sodium content, and you're back in hospital. So a very simple intervention by giving them nutritious meals just changed that. So are we ready for a hospital without no patients? It's already happening. There's a hospital in the US, it's called the Mercury Hospital. So 100 doctors, nurses, technicians walk in, but there are no patients because their aim is actually to keep the patients out of the hospital. So I think that, in a way, is the hospital of the future. You must be following the RSNA, which is going on in Chicago. The top 6 deals yesterday were on companies with artificial intelligence. On the radiology side, it's about saying, how do you take artificial intelligence as you go ahead? So I think what's changing is where is care delivered, by where and by whom is changing. So it's not that the clinical engagement is actually going to happen in a hospital. It'll often happen at your home or even at a retail setting.
The adoption of video-based medicine is a huge, huge paradigm shift that our entire American society is going through right now, from the millennials all the way to the silver generation. The early adopters here are typically caregivers. More often, it's a mother with younger kids, and usually the mother's a working mom. 83% of Dr. On Demand's patients are female. 75% of them have school-age kids. It's the convenience part.
What is disruptive is, could you actually deliver full, robust care to a consumer and not need a provider at all? What is changing is the paradigm of the role of the physician, where they're not the quarterback. They may not even be the coach. They may be the general manager. What they help do is put other people and other systems in place to enable a wide range of consumers to get care. And instead, the physician's role changes, which is, I don't need to be in the room as a physician. Instead, I just make sure the system is operating correctly. We view that as the most disruptive thing occurring because it really changes the paradigm, which is a very labor-dependent model in the healthcare sector.
There's urgent care clinics, and you can get your flu shots at CVS and at Walmart, and there's a million apps out there that help keep you healthy. So I'd say the influence of the new consumer expectations, along with the technology and the expectation that you can keep us healthy, that's where the innovation is occurring, on the front end and on the back end. So we've got innovation and technology that are working on both of those ends. And it really is probably the most fascinating and fertile time to be in the healthcare industry to think about those things.
So I think a very fascinating time to be in healthcare. I just put this slide saying, how would Jeff Bezos run a hospital? Or he runs Amazon. But last year he also bought the Wall Street Journal, and this was his first foray. I think so why I put in this, because I think going ahead we look at how does technology actually look at healthcare. One of the things is they build scale first, worry about profits later. Expand the customer base. Today our customer base is only someone who walks into the hospital. Know about your customers. Once our patient walks out, we don't have any idea whether he's alive or dead. Then healthcare, like news, is a perishable commodity. So if empty beds, can you use them for something else? And finally, can you become the technology provider to the healthcare industry? So that's the paradigm which is going on. There's always a debate about which is the best healthcare system in the world. And I tell you, the healthcare system is today based on ease of access, convenience, outcomes, and spend. But I think the healthcare system of tomorrow will actually be based on technology. The technological access to care would be greater than both the geographical and the financial access. Because going ahead, I think if you want to win in this market, you don't only need the best doctors, you need intellectual property which differentiates you, something you can do better. And finally, you need technology to deliver it. Because, I'll end with this quote, because the new game begins before the old one is over. So we don't have time. We are on a very short switch if we want to change over. Thank you.